Well, hello everyone, and welcome today to our booster session, Staying Grounded During COVID-19 Staff Health and Wellness. We are very pleased to have you all with us today. There's a large group of you here, and I'm just going to give you a brief bit of housekeeping to get us started, and then let you know how the session is going to go. So these booster sessions are designed to support our health system workers. We know that right now our COVID-19 response efforts may be bringing some additional stress and anxiety. So these are short and relevant and timely presentations designed to fit into your busy schedules and hopefully just give you a bit of support. We're very pleased today to have Karen Kaliak here with us talking about staying grounded. So this session is going to highlight some simple strategies to enhance your ability to focus, to keep things in perspective, and to stay grounded during the prolonged stress of COVID. So we are going to be taking some questions at the end, and there's a question tab on your right. If you've never used GoToWebinar before, we are going to be answering questions at the end. And my name is Daniel Dacombe, and I am going to be answering the questions or curating the questions for us today. So because there's a large group of us here today, we're not going to be able to answer all the questions, but we will select some. So please use the question tab on the side to ask, and we will do our best to get to you. And now I'm going to turn it over to Karen. Karen, thank you so much for being with us today.
Thank you very much. Hello, bonjour. Welcome to the booster session, Staying Grounded During COVID. And I'm so pleased to be your facilitator today. Before we talk about what we can do to stay grounded during COVID, it's important to first acknowledge all that we've been through. So change, disruption, and uncertainty has been present for quite some time. One study by the Association of Canadian Studies showed that the majority of Canadians felt that their lives have been changed. 43% in a major way and 47% in some way. What we are all experiencing is considered prolonged stress exposure. Prolonged stress exposure means that we are under long-term stress without a predictable end in sight. So it can be very taxing to manage. So acknowledging what we are going through and also validating that it's understandable why many of us may be experiencing a range of strong emotions and reactions right now. A colleague recently said to me, the relentless nature of this pandemic is starting to take its toll on so many, and likely we would all agree with his reflection. This is why we need to find ways to minimize and mitigate this prolonged stress exposure so that we can stay healthy and well despite COVID. So how? There are things within our control and without our control. We may not be able to control the changes and stressors we are experiencing due to COVID, but we can control our reaction in this moment. That's why having a wellness toolkit that includes staying grounded during COVID is important. So today we're talking about grounding techniques, and you'll see in your right panel, there's two handouts, the slides, as well as a handout that actually covers everything today. So no need to take notes. I'm hoping that you'll fully participate and experiment with me using some of these grounding techniques to refuel, reset, and maintain a healthy perspective. Grounding is simply using strategies to center our minds and bodies, in essence, giving us a break from strong emotions we may be experiencing, such as fear, anxiety, sadness, and anger. When we take time to use grounding throughout our day, we then have these anchoring techniques in our wellness toolkit to use anytime and anywhere. Grounding doesn't take away the stressor or solve the problem causing the strong emotion or reaction, but it does give us a chance to regain control and regain a sense of calm. As we explore some grounding techniques together, perhaps think about where you can use them, in what situations at work or at home, or perhaps who else you may share these with such as colleagues, friends, and family. I hope that you see this as an opportunity to reflect on your well-being, keeping in mind that grounding is only one part, perhaps an important part of our wellness and personal wellness. The first strategy I'd like to introduce to you is nasal breathing. It's a quick reset to refresh. Through your nose if you can, or else gently through your mouth, take 5 deep breaths. So breathing in for the count of 5, hold slightly, and out for the count of 7. Breathing in for a count of 5, hold slightly, and out for a count of 7. Focusing on your breathing, clearing your mind at this moment as you breathe. As you continue to breathe, I'll explain the neuroscience behind this strategy. So nasal breathing cools off the amygdala, the emotional, reactive, flight, what the heck is going on part of the brain, and then activates the prefrontal cortex, which is the logical, problem-solving, focus part of the brain, supporting decision-making. When to use? Well, this is something you can do anytime, anywhere. 5 focused breaths to reset. At work, we can start our day off with nasal breathing or use it in between patients or home visits or during meetings. At home, as parents, we can teach this to our children to use before or at school if anxious, before and during tests, or just to calm down after a hectic day. Next, one way to practice and get into the rhythm of your nasal breathing is through this figure 8 breathing technique. This technique has the added benefit of physical grounding, which helps with focus and can be used when there is the need to settle, slow down, and regroup. Let's do this together. On your forearm, imagine your finger is a pencil and you're drawing the figure 8. Breathing in for 3, pause for 1, out for 3. Breathing in for 3, pause for 1, out for 3. Breathing in for 3, pause for 1, and out for 3. A key message is that practicing while you are calm then leads to this technique being available to you when you feel emotional or when you feel a lot of pressure, and which we all do from time to time. When to use? I've used it with my children when they were young to help them drift off to sleep, drawing on their backs to calm and soothe as they fall asleep. Or I've personally drawn on my hand under boardroom tables during difficult conversations or meetings. No one knows I'm using this grounding technique, yet it helps me to maintain my composure in the moment, regardless of what's happening around me. The stop technique moves us away from reactive to proactive responses. In high pressure, stressful moments, this is called breathing space. Basically, it is stop what you're doing and interrupt your thoughts. Take a few deep breaths, use your nasal breathing, observe what's happening around you and inside of you. What can I see? What do I hear? What am I noticing? What am I thinking right now? What am I feeling? And as you breathe, deciding how you will proceed and choosing how you will respond and what you will do next. What is the most important thing for you to do right now? A story of when I used the stop technique in everyday life. I was rear-ended while driving a few years back, and my first reaction was, oh gee, I'm going to give this young kid, a teenager, a piece of my mind, probably on their cell phone. But before I got out of my car, I stopped, took a few breaths as I reached for my car registration in the glove compartment. And then as I was observing, I noticed what was happening around me, how distressed and upset the young person was. She was crying and scared, and my choice of reaction shifted to decide how to proceed with care, with understanding, and reassuring the young person, it's okay, it's only a car. I'm glad we're both all right and unharmed. This is a real life example. Sometimes things are dialed up really high, and the 5, 4, 3, 2, 1 strategy is commonly taught to people who experience anxiety attacks or who feel overwhelmed, using all our senses to help us get back to the present moment by using sensory anchors and calm breathing. You do this by sitting comfortably in your chair, taking a few deep breaths, and then if you're comfortable, you would close your eyes, continuing to breathe, breathing in and breathing out. And then you would open your eyes and name out loud 5 things you can see. You can look around the room, your tea mug, a clock, a plant, or out the window, perhaps a tree, the sky, or a nearby building. 4 things you can touch: the comfort of the chair supporting you, the table in front of you, your hair, or the warm tea mug cupped between your hands. 3 things you can hear. And when we're quiet, it's amazing what we can hear in our environment, like the sound of traffic or birds outside, maybe distant talking or music playing, or even the fan, the ventilation fan on top of us. 2 things you can smell. Maybe it is your tea or coffee, fresh laundry, or your colleague's lunch right now. 1 thing you can taste, and this one's a little bit harder. So you can recall a vibrant taste like a fresh strawberry or a piece of chocolate, or you can have an aid with you just in case, a piece of candy that you can then put in your mouth and taste and savor as you continue with your calm breathing, being fully aware in this moment as you breathe. I included self-compassion because as healthcare providers, you are so good at taking care of other people, yet often we are so hard on ourselves. Self-compassion is about extending that same care and kindness that you offer to others to yourself. A few components of self-compassion on your slide are, it's a way of relating to yourself just like you would support others. Acceptance of what is happening right here, right now, in the present moment. Acceptance that pain and suffering and hardship is human and we all go through it. It's common humanity, and kindness towards self during this moment is needed. I've included in your participant handout a 6-minute self-compassion guided practice. It's a live link facilitated by Dr. Germer. He's a clinical psychologist, and I encourage you to try it in your own time. But let's do one right now. It's called Friends. This is a great tool to use when we are experiencing a rough day or having a difficult time in our lives. It's an effective exercise to regain perspective and to tap into a more compassionate approach to our situation. Let's do this together. Think about a struggle you're having right now, mild to moderate. Nothing severe, nothing complex. Think about a mild to moderate issue, worry, or concern that you have right now. Maybe it's a conflict with someone. Maybe it's something related to COVID. Just think about it quietly to yourself right now. Now, imagine a friend coming to you, someone you care about, and they share with you that they are going through the concern, worry, or issue that you are thinking about right now. How would you respond to your friend? What would you say? Maybe something like, oh, I'm sorry to hear you're going through this. Sounds like a really hard time for you. Sounds tough. What do you need right now? Do you have others you can talk to? Who or what has helped you in the past? Is this available to you now? I care, and I'm here for you. The next step in this exercise is all those things you would say to a friend, say to yourself. Respond to yourself the way you would to a friend. This is really tough for me right now. This sucks. This is hard. You know, maybe it's a mistake you feel you've made, and saying to yourself, I have to remember we all make mistakes. I will learn from this. I'm doing the best I can with what I have to offer right now. I will be okay. I have others I can talk to for support. I'll get through this tough moment in my life. Self-compassion is basically responding to yourself with kindness during life's difficulties. The last strategy I'll cover today, called the 3 good things, like self-compassion, can assist us in shifting our perspective. Just a quick personal reflection. What do you usually think about at the end of your day? Things that went right, or the one thing that went wrong? Such as the driver who cut you off in traffic, or the one thing you didn't get done on your to-do list. Shifting and retraining our brains towards noticing what went well helps build new neural pathways in our brains and shifts us towards a more optimistic perspective. This is how you do the exercise. You write down 3 good things in your day. Now reflect on your role in making these 3 good things happen. And I encourage you to do it daily and share with others. When to use the 3 good things? Well, I encourage you to try this at the end of your workday or before you go to sleep or even at the family dinner table. This strategy helps to shift our perspective towards optimism and gratitude. So grounding is a part of your wellness toolkit to manage daily stressors. It's part of your self-care. But even if you don't feel you need to use grounding right here, right now, that's okay. Practicing gives us the experience of paying attention to how and when we may choose to use grounding techniques to mindfully reset despite or during COVID stressors or any other life challenge we are facing. And then it becomes available to us when and if we do need it. So practicing and planning to use grounding is a good strategy in itself. So I'd like to close off the session with you today, reflecting and planning on what, when, and how you may use grounding techniques throughout your day. You know, what grounding technique would you like to try? Maybe something you heard today or another technique that you know of and you want to use again. When, in what situations or moments in your day, at work or at home? Some examples I have for you include using stop during code whites or practicing nasal breathing before a meeting or during a difficult conversation, using self-compassion before you leave the workplace to help you transition to other parts of your life, or the 3 good things at the dinner table or on a yellow sticky by your bedside to end your day with a gratitude exercise. How? What needs to be in place? This is so you can plan it and make sure that it happens. Scheduling it in your calendar or perhaps reminders or cues in your environment, you know, nasal breathing each time you get your cup of coffee in the morning, or self-compassion in your car before you go into your home after a long shift at work. The idea is to create new daily habits that help you to reset, refuel, and refresh, supporting your overall mental health and well-being. If you want to explore more, I highly recommend this free program for us to use as healthcare providers. It's a self-directed online program, 10 modules based on cognitive behavioral therapy. And the benefit is that you get this support and coaching from an experienced therapist. I've included this live link in your package along with other resources as well. These are the references that inform today's booster session. And I'd just like to finish with thank you, merci, for taking time out of your day to attend the Staying Grounded During COVID booster session. My hope is that there was something helpful to you today. Stay well, be well. Thank you for participating. Oh, and I should mention, please stay tuned. There are upcoming booster sessions with other guest presenters on a variety of topics, and we hope you'll join us again. Thank you, Missy.